Hi, Dr. Saxena here. I've been talking on various topics and what exactly as physicians we had been practicing few things, and this has been known since centuries. People had emphasized on the role of intestinal health. If you're able to have a good intestinal health, all the diseases and all that become secondary, and what is needed is you need that functioning digestive system, which is one of the cornerstones of the good health. And when the digestion is working, other organs too are working optimally. So this is one thing which you have to always think, because the digestive system is responsible for processing the nutrients in our body. And when we process this particular thing, and which in turn is used as a fuel for other physiological processes in the body, optimal nutrition is hence essential for the growth, reproduction. You have got, and the normal functioning of every organ, be it tissue repair, development, whatever you call healing, and all sorts of things. It requires a optimal, healthy digestive system. When you have a digestive system, this is the reason digestive system is responsible for supporting the health of the body as a whole. And when we talk about this particular thing, it is not just providing the fuel for the body. The intestinal tract also plays as an integral role in the functioning of the immune system, immune and nervous system. This is one thing which I always emphasized, and there is a Michael Gerson has emphasized his book, which he entitled this as intestines as a second brain. And this is that gut brain connection which is of utmost importance. When we talk about this, two-thirds of all the immune activity occurs in the gut. And this is one thing which we always have to understand that. And having worked in areas of autism and a lot of autoimmune disorders and all that, I believe there is a remarkable response which we happen when we try to optimize this intestinal health. And we this is not a rocket science. It has been told for probably centuries now. Even our Ayurveda had laid a emphasis on intestinal tract. There's always this intestinal health will always reflect your stomach, intestines, and all. It will all this health is optimal. It reflects on your other parts as well. So this is. You need to understand this. There is a connection between the gastrointestinal, immune, and central nervous system. So this is one thing have been there is a growing interest in the past for few years now about nutrition. People are trying to understand nutrition at a big level, trying to work it out because of the social media and a lot of information overload. People are trying to understand how to give a lot of emphasis on the nutrition part and all that. So many books have been written and on this particular subject, and it's possible now to treat every ailment. It's possible to treat every ailment today, what we have been plagued, with a well wholesome and well balanced diet. Of course, there is always there are exceptions to a rule, but most of the things can be managed by that particular things. We need to look into what are the hidden allergens and so many things which we try to work it out. So this particular topic of intestinal health, immune system, as well as the central nervous system, the top floor brain activity is related with your diet. And I need to definitely, this is one of the things which I was not aware. This intestine is a second brain which is being told about, and this is one thing which now I believe this is absolutely true. Your intestines has a lot of plexuses, you have got autonomic nervous system, a lot of stuffs are there. So that is the second brain which is now considered as, and it is definitely true when we see the kind of reactions, and we see the kind of issues which crop up just by not selecting a proper diet and all that. Example, I can always talk about some nutritional deficiencies that can result in a whole host of systemic problems, right from your asthma to skin conditions to neurological and immune problems because of this. So we I started understanding about this, and we looked into what is this importance of digestive health when it comes to autism and all. And to my surprise, I was able to get into that when I started working on autism. I knew that there is something in the intestinal health which is a kind of worrisome, but now I see usually every other chronic issue, chronic health problems have a basis at the gastrointestinal tract. It is can be a something like hyperpermeability because of a leaky gut syndrome, or it is something like malabsorption, or sometimes it is a enterocolitis, or people with liver detoxification problems, people having fungal and bacterial overgrowth. You have got sulfation deficits, lot of host of things. But I can relate these particular things. I put across into one of the things, and try to understand how things can be worked out. So just by devising a diet, I can always tell you about specific carbohydrate diet. If we can work on this, we are able to work on the people who has ulcerative colitis, or people who are having something like Crohn's disease, or people having some reflex esophagitis, chronic duodenitis. So these are the things which does matter, because at the end of the day, what is really happening at this level is that small problems, the hyperpermeability, malabsorption, it is inflammation. So lot of things which are so. In autism, I saw usually there are abnormalities found in the autistic children, which can substantially compromise their digestive function, which in turn interferes with their ability to properly process foods, and results in significant nutritional deficiencies. Some of them are most common vitamin and mineral deficiencies seen in these individuals. Probably something of zinc, magnesium, calcium, and vitamin B6. These things are not properly processed, and some of these common vitamin and mineral deficiencies are this all combined, and along with the thing called food sensitivities, and you have got environmental chemical exposures and heavy metal toxicities may explain the wide array of neurological, immunological, and other systemic complaints the children with autism do have. I was initially I was focused more on autism. Now I see a person having something like migraine. I have somebody is having some kind of other issues, but I can always clearly relate his or her migraine is a consequence to your intestinal health. Something is not getting processed properly at your intestinal level. That's the first line of defense. So this immune dysfunction starts at that level, and you need to really work it out at this particular thing. So along with that, we see all other autoimmune disorders, something like rheumatoid arthritis, psoriasis. All things have got a root, which is intestinal health is in jeopardy. They are not, they doesn't have that balance. There's a hyperpermeability issues, leaky gut issues, and all that. So these are all the things which I, as a I try to work it out in a simple way that will help people. So this is the basis actually of any chronic disease, and I need to, that's the reason I need to start at the intestinal level to start fixing up the things. Thank you.